My name is Dr. Nikhil.S.Parwate. I am a senior consultant. I head the Department of Colposcopy and Robotic Services at Aditya Birla Memorial Hospital. I work here as a full-time gynae-onco surgeon. The topic given to me was about cancer cervix screening. All of you are versed with taking pap smear. But believe me, honestly, pap smear has completely ruined the process of cancer cervix screening simply because majority of the doctors are not taking correctly or not putting the slides properly, not fixing properly, neither it is going correctly to the lab, and even the laboratory has different methods of interpretation. For example, Bethesda 2014 is the standard method of reporting a pap smear, but unfortunately it is not happening, and still I see a lot of pap smear reports which says mild dysplasia, moderate dysplasia and severe dysplasia. These are unacceptable reports on pap smear. So what is that method? Is the age-old method of VIA, visual inspection by acetic acid. Pap smear has taken us nowhere as far as cancer cervix prevention in India is concerned. You see the cervix with a speculum, apply 5% acetic acid and see whether you see an aceto-white area or you don't see an aceto-white area. 3-yearly screening by VIA for women about 30 years is helpful in reducing the cancer cervix mortality by 35%. And to make VIA more accurate, we now have digital VIA using artificial intelligence. The patient can get a printed report there and there. If required, the suspicious aceto-white areas can be biopsied there and there itself. Once a patient is VIA positive, the next step would be to refer her for a colposcopy test. Based on the type of lesion we see, we categorize them as CIN1, CIN2 and CIN3. So CIN are precursors of cancers. Please do not scare the patient that there is a cancer, and please do not do hysterectomies. So CIN1 can be left alone. Now we have the Foxy GCPR guidelines, of which I am also a part of it, where we have made correct guidelines on how to treat CIN1, CIN2, CIN3 pre-cancer lesions of cervix. So CIN1 can either be left alone, or at the most you can do cryotherapy or thermocoagulation. CIN2, CIN3 you need to decide individually. Majority of these patients will require a proper loop excisions, which we call LLETZ, large loop excision of transformation zone. One thing I need to remind all the doctors: no biopsy of cervix should be without colposcope, except for frank cancer of cervix. But otherwise, if you are trying to find out pre-cancer lesions of cervix, the biopsy has to be colposcopy guided and not blind guided. Second thing what I need to tell all of you is, discard the punch biopsy forceps that you have in your instrument trays. It is absolutely a useless instrument, and use good Tischler biopsy forceps, which gives you good biopsy of cervix and which also gives good tissue to the pathologist to report. The WHO has set a goal that by 2030, India should be on the path of elimination of cancer cervix, and for this they have given a formula of 90-70-90, which means 90% of eligible girls in this country should be vaccinated by HPV vaccine, 70% of the women should be screened. So if you are going to do pap smear where you do the smear, 90% of the times are wrong, going to the laboratory, then laboratory giving the report, the time spent in that, we will never achieve 70%. So you do a VIA, on the spot decide whether it is positive, negative. In the same setting, you can also do a biopsy if it is required, if it is white, and in the same setting you can also do a colposcopy guided cryotherapy for low grade lesions, which we say CIN1. So everything for that woman occurs in one sitting. So that is why 70% screening, if we want to achieve, it is VIA, and 90% of the patients should be treated in CIN, not in cancer. So unless and until you do massive screening, you are not going to pick up women in CIN, and once you pick the women in CIN, you are going to prevent a cancer, because CIN is not a cancer. So if at CIN level, only if the woman is hot, where the treatment is so easy, cryotherapy and leads, which is done under local anesthesia, and after the procedure within 2 hours the patient goes home, you prevent an hysterectomy. So please start screening, please start vaccination, please start picking up patients in pre-cancer lesion by doing a VIA screening and refer them to colposcopists. Prevent them from dying of cancer cervix. Thank you.